Hi everybody, this is Venk with Always On EM. As you know, I'm at ACEP in Las Vegas. I'm really excited to meet Humayd. Humayd, do you mind sharing with us about who you are and about your project today?
Sure. Hello everybody, my name is Humayd. I am a second year medical student at Rowan Virtua School of Osteopathic Medicine in Stratford, New Jersey. So the study that we came up with was the Laryngeal Mask Airway protector versus the endotracheal tube, comparison of insertion times and first insertion attempt success rate. So the idea behind this project was that in the ER that I worked at as a tech for 4 years, we use a lot of endotracheal tubes, but not a lot of laryngeal mask airways, the LMAs. And so a thought that came into my mind was why? In an emergency scenario, you want to be able to establish an airway as quickly as possible. Obviously to get the patient oxygenated in whatever scenario. And so it got me thinking, a lot of these LMAs that we don't use end up going to waste, after their expiry date. So, why not see what their application is in an emergency scenario? So, what we did was, across a bunch of studies, what we did was we focused on the LMA protector, which, according to LMA, the company, is boasted as their most technologically advanced LMA. So, which is why we decided to go with the LMA protector. So, compare their best of the best to the industry standard or the gold standard, which is the endotracheal tube. And so what we found was that in order to compare which one is faster than the other, we used two parameters. One is first insertion attempt success rate, and the other parameter was the mean insertion time. So as you can see here, what we found is that the endotracheal tube actually had a higher first insertion attempt success rate. However, conversely, the LMA protector actually had a shorter insertion time. And so while the endotracheal tube is still the most commonly used airway management device and does have a higher first insertion attempt success rate, the LMA protector does deserve some recognition in this case, given its much shorter insertion time compared to the endotracheal tube. And of course, the fact that the endotracheal tube has a shorter first insertion attempt success rate could be due to the fact that there are, the endotracheal tube is the gold standard and it is used a lot more. But for all we know, if the LMA protector is used, closer to the amount that the endotracheal tube is used, we could probably help close that gap of the first insertion attempt success rate, and maybe even eventually, get the LMA protector or any LMA for that matter to, have a higher first insertion attempt success rate and overall be, much more feasible for emergency airway stabilization, especially, in emergent scenarios.
Nice. And so, have you done a systematic review and meta-analysis before this?
This is my first one, actually. Yeah,
nice. You think you'll do another one?
I think so. It was interesting, and especially
Okay.
it's something that I decided to answer this question because it's a question that I had myself. Because once all these LMAs, we throw them away in the garbage by the dozens, and some of them were unused. So it's not just from a financial aspect of your hospitals are buying so much of this equipment and a lot of it's going to waste, but also it could very well have better patient outcomes, as we can see in terms of the mean insertion time.
Yeah. Well, as an aside, the other thing we do at Mayo is we'll donate a lot of our unused equipment to countries overseas and other organizations that can repurpose them.
Yeah, that's another great idea, because I'm sure again, a lot of expired equipment, I'm sure or even closer to its expiry date, I'm sure it's still, okay to use.
It's quite functional. And then also we host some big educational events, and so we'll use them for those events as well.
Exactly, yeah.
This is really great. So thank you so much for walking us through your work, and I wish you and your team a bunch of success in publishing this, and also a lot of fun here in Vegas.
Thank you for your time, appreciate it.
Thank you.